Living with chronic back or neck pain is it's tough, right? Especially when you feel stuck and aren't sure what to do next. Well, if you're looking for a clear path forward, you're in the right place. We're going to break down everything you need to know about facet joint treatment and give you a simple, clear plan. We'll be using this guide from the folks at Elite Pain and Health to walk you through the whole process. Think of them as your partner in this, helping you navigate every step so you can get on the road to feeling better. So, does this sound like you? Are you just tired of the pain, tired of the uncertainty, and you just want to know what your options are? Good. We are going to map everything out for you so you feel totally prepared and confident about what's coming next. Let's dive in. Here's our game plan for today. We'll start with what's actually causing the pain. Then we'll get into Medicare's rules, super important, cover what you need to bring to your visit, walk through the treatment itself, and then answer some big questions. It's a clear roadmap from A to Z. Okay, first things first, before you can fix a problem, you've got to understand it. So what in the world are facet joints? And why are they giving you so much grief? So picture your spine as a stack of building blocks, right? Those are your vertebrae. Well, the facet joints are like these tiny little hinges connecting those blocks. They're what let you bend and twist. And just like any hinge on a door, with time, injury, or arthritis, they can get worn down and rusty. And that's when they start to hurt. Do any of these sound familiar? That dull, aching feeling deep in your back or neck? The kind of pain that really yells at you when you try to stand up straight, but then kind of quiets down when you sit or lean forward? Recognizing these little signals is the first big clue that we might be on the right track with facet joint pain. All right, now for a really crucial part, the rules. I know hearing Medicare requirements can sound complicated, but try to think of them less like hurdles and more like a checklist to make sure this treatment is absolutely the right move for you. And here's the key thing to remember. It's not about meeting some of the criteria, or most of them. You have to check every single box. Paying really close attention here is going to save you a ton of time and potential headaches down the road. Okay, rule number 1 is all about time. Your pain can't be something that just popped up last week. For Medicare to cover this, you need to have been dealing with moderate to severe pain for at least 3 months. It has to be a chronic, ongoing issue. Next up, you need to show that you've already given other things a fair shot. Tried and failed is just a formal way of saying you've already done things like physical therapy, you've tried the over-the-counter stuff like ibuprofen, maybe you've even seen a chiropractor, and you're just not getting the relief you need. It shows that it's time to move on to the next level of care. And this is a big one. The type of pain matters. This procedure is for what's called axial pain. That just means the pain is centered right in your back or neck. If what you're feeling is mainly radiating pain, that sharp shooting pain that travels down your leg or into your hands, that actually points to a different problem, probably a nerve issue, which needs a totally different kind of treatment. Okay, now we get to the part where you can really take charge. This is all about what you can do before your visit to make sure everything goes as smoothly as possible. A little prep work goes a long, long way. Take a good look at this checklist. Every single item tells a piece of your story. Your records prove how long you've had the pain. Your PT notes show you've tried other treatments. Bringing all this stuff with you makes it so much easier for the team to see the whole picture and get you on the fast track to treatment. So you've done your homework, you've got your documents, and you qualify. What happens next? Let's pull back the curtain and look at the actual treatment journey, step by step, so there are no surprises. It's really just a logical 4-step process. You start with the evaluation, then you do 2 diagnostic tests. These are key for pinpointing the pain, and that all leads up to the actual treatment, which is called radiofrequency ablation, or RFA for short. Now, this is the really cool part. Check out this timeline. The whole thing can happen really fast. We're talking from your first visit to your final treatment in as little as 3 weeks. Now, that final step, RFA, what is it? Well, the first 2 injections find the exact little nerves that are sending the pain signals. Then, RFA uses a gentle warmth to just quiet those nerves down for months, sometimes even years. It's basically like flipping the off switch on your pain signal. Okay, I'm sure you've got some questions popping into your head right about now, and that's totally normal. So let's just go ahead and tackle a couple of the most common ones right now, just to make sure we're all on the same page. This is probably the #1 question people ask. If the first test works and I feel great, why on earth do I have to do it all over again? It's a great question, and there's a really important scientific reason for it. The reality is, a single injection can sometimes give what's called a false positive. That means you might feel better for a little while, but it might just be a placebo effect and not because we actually numbed the right spot. Doing it a second time confirms the result. It's how we become certain that we found the true source of your pain, which means the final treatment is way more likely to work. Okay, here's another very specific rule that can seem a little strange, the 80% relief requirement. Why such a high number? Why isn't 70% good enough? Well, it's not a random number. It's based on a lot of data. 80%. That is the magic number, and it's the benchmark that really predicts whether the long-term treatment is going to be successful for you. And here's the bottom line. This strict rule is really for your benefit. The research is crystal clear. Patients who hit that 80% relief mark during the tests are the ones who get the absolute best, longest-lasting results from the final procedure. It's all about making sure you have the highest possible chance of success. Look, I know this is a lot of information, a lot of rules, a lot of steps. But the most important thing I want you to take away is that you are not alone in this. There's a whole team of people ready to help you and guide you through every single step. So you have the map now. You understand the rules. You have your checklist. You know what the journey looks like. The path to feeling better is right there in front of you. The only question left is, are you ready to take that first step and start getting your life back from pain?